using palpation-based acupuncture. Our speaker today is David Euler. He's going to share a Japanese style of acupuncture and reflective-based palpation and treatment. Hopefully, he's going to give a little bit of his own introduction. I've seen David on the lecturing circuit for eons and eons, and I've seen his lectures back in the day when they were DVDs. David, I'm going to do one screen share on my own first before I bring yours up, all right? I'm just going to show this disclaimer slide. And so in a minute, I'm going to bring up David, and he's going to give you an incredible lecture based on what I've seen him do before. I've seen the handouts now. They're excellent. Post your questions during the live webinar in the chat, and we'll moderate those for David. And just want to remind you that for today's lecture, our disclaimer here is that this is for educational purposes only. This is not medical advice. It's not intended to be. And so you should not interpret it as medical advice. This is for continuing education purposes only. If you have a health condition, please do seek out a qualified healthcare provider, for this is for educational purposes only. All right, David, we are looking forward to your lecture, the videos that you've created, and thank you very much for choosing to teach this on Healthy Seminars, to share both your clinical experience and your practical knowledge. I'm really looking forward to this lecture. Thank you guys for choosing Healthy Seminars. Post your questions during the live chat, and we'll moderate those to David.
Okay, welcome. And yes, just to make sure that everybody is on the same page, I love questions, and I definitely think that they will promote and deepen knowledge. However, since we have really a very defined time frame, and I want to try and keep, on focus, it is best to put the questions in the chat, and then at the end of the seminar, I can then basically answer them in an order so that it makes sense and also fits in. A lot of times, that is my experience. A lot of people have a question, but then during the lecture time, it gets answered by itself, right? So that is one thing. The other thing is, it is wonderful to see your faces. This is, for me, the most important tool, I think, to deliver a lecture that is useful to you, since if I see your face and your expression, I know when to stop if I speak nonsense, and I know when to elaborate when I see a big question mark in people's eyes. And it's nice to speak to somebody. It makes it more personal and obviously a little bit more to the point. Good. Having said all of that, this topic, I think you understand, is huge. It's, saying acupuncture for gynecological conditions is saying, acupuncture for a healthy human being. So it actually really involves everything. I do know, and I am aware, that there are books that are concentrated on gynecological issues and acupuncture, and for each condition they have a set of points. And a lot of times these are very valuable in order to focus our, I think, treatment strategy towards something that we can at least know how to begin and then develop from. However, the way that I see the topic is really from a constitutional point of view. Why does a person develop, these problems? And then through the problem itself, also ask the question, and this is why people come to us as acupuncturists, why can the person not heal by themselves? Yes. Why can that body, which is designed to heal, not actually repair itself? And here we find many things that are a big part of this lecture, rather than, okay, for the uterus, we do these points. For the ovaries, we do these points. For everybody knows how to do that. The books are out, open the page, copy that. But that's not really what's going to help us in clinic. Now, usually this topic for me in palpation-based acupuncture and from the constitution through the symptomatic presentation, this topic takes about 2 full weekends to basically get a grasp. However, I want to give you a tool that you can take to your practice the moment you finish listening to this webinar. I want you to take the tool into your practice and start working. So I want to stay within the limits of the time, within the scope of the, I would say, topic, but give you practical things that you can start doing. And then also, if you look at all the handouts, which is a big packet, you know, understand that there are many different other options if the one thing that you tried didn't really work. However, when I'm presenting to you, I present to you the things that work the most, okay? So to example, to reduce the pressure pain on the left side, lower abdomen, you know, around stomach 27 on the left side, we use liver 4. And for the most, it really works well, okay? And I will tell you some angles and tricks, but that usually, the few where it doesn't work, you can continue to watch the handouts and you see there's different ideas. And there's always room for elaboration on the topic, creating another series of lectures that will augment this particular lecture in its little corners. So the attempts here, you know, again, not to go symptom by symptom or from the most common symptoms why women can come to us as acupuncturists to seek help, you know, oh, menopause. Can you give me the point for pelvic pain? The point for pelvic pain, right? Or can you give me, you know, the treatment for chronic cystitis? Or can you please give me... That's not the idea here. I'm happy to do that. And obviously, I also published, like say, the volume 2 of the 2 books that I published, you know, it's there, yes. However, I want you to understand that there are avenues that bring the patient to its condition, yes? Paths of least resistance where the entire lifestyle, the pre-heaven influences, the post-heaven influences, yes, they will all lead to very specific, I would say, approachable tasks, switches that we can turn on and off, neurological switches, structural switches, hormonal switches, okay, influences we can call them if you want, or organ switches, all right? So we look at what feeds into the neurological tube, what feeds into the structural tube, and then we'll look at the patient and say, she may have the pelvic pain because her pelvis is sitting, you know, in an angle, tilted somewhat. She has major stresses going on, and, you know, she is maybe consuming a lot of processed food, which influences the hormonal secretions. Now I know why she has this presentation. It's not needling the point for the symptom ad infinitum, giving, you know, the patient some relief. It's actually trying to understand how to solve the best we can the problem. All right. So this is the idea here, and again, it's a huge attempt in this time frame to actually work. So I will give you right off the bat the reflection points that whatever we do, whether it is working on the neck in order to reduce the influences from the nervous system or balance the influence from the nervous system, whether it is working on the pelvis and making sure that the pelvis is not tilted and or shifted and or twisted, you know, or whether it is working on liver, spleen, meaning on internal organs. Whatever we do, we always go back to these particular points that are related directly to the gynecological presentation. Okay, so kidney 16 may not, if you want, very intuitively relate to reproductive organs. However, it is used as the reflection of the navel. It is used as the reflection as what we call the initial first trauma, the birth trauma. A German physician by the name of Hunecke, who is considered the father of the neural therapy, he uses the scar, yes, the original scar, the first scar, and that is the navel, in order to check, and he uses it to treat. He injects right into it, yeah, or used to inject right into it, to basically go back to remind the body from its origin and the moment of birth. So the whole process of birth, giving birth, conceiving, etc., is reflected around here. The stomach 28 region is a reflection of the ovaries, where when I say reflection of, it means actually I'm pressing on the area which underneath it are the ovaries, or this is the area which is closest to the ovaries from palpation above into the body. Yes, it definitely should not be painful. When a woman is ovulating and comes to us for whatever she comes, yeah, shoulder pain, headaches, migraines, eye pain, foot pain, doesn't matter. And she's, if the process of ovulating, we will, and it is normal to find, you know, some sensitivity on the actual ovary of ovulation. So, you know, every month it changes left, right, left, right. We can take that into consideration. So when we palpate here, right off the bat, it's like, oh, is this usually the time when you're ovulating? So, you know, we can factor that in, but usually when we palpate and it's, ow, you know, painful, there is a dysregulation, and it doesn't need to be during ovulation, all right? We will talk about that. Kidney 13 right there, you can see it's the edges, you know, of the uterus, directly related. So if we have swelling, if we have inflammation, if we have cysts, myomas, fibromas, etc., these are the areas that we will palpate and make an evaluation on how to treat. Stomach 30, again, it's more from the TCM perspective. This is the city of Qi. This is also the big meeting point of the meridian system, and definitely, if you want, a reflection of the Chongmai that is part of the connection of the 3 or 4 or 5, depends what doctrine of acupuncture it comes from, C's, yes, the C of blood, the C of grain, the C of Qi, and if you want the C of marrow, different doctrines have different C's, but that's the Chongmai, and that's a very important connection that we will make, and you will see through the Bao as well, Bao Mai. Also, it is a great evaluator of the status quo of the pelvic floor. This is obviously in the region where the inguinal ligament meets, you know, the pubic bone. We will have another one, which is at the ASIS, at the anterior superior iliac spine, but that will be more from a structural point of view. So these are the reflexes that we are wanting to clear, all right? Clear meaning no matter what acupuncture treatment we do, yeah, we always go back to these reflection sites and say, did I succeed in reducing that particular area? A woman comes in with complaints of menopausal symptoms. Okay, now we know that it has to do with the autonomic nervous system. We know that it has to do with the pituitary gland. We know it has to do sometimes with the thyroid, and we know it has to do with the ovaries. We know it has to do with the deficiency of yin, if we want to switch paradigms, yes, and maybe the growing excess of empty fire, and then maybe even true fire. We know that, and However, we keep pragmatic. We can evaluate, you know, these reflection sites, 1, 2, 3, 4, if you want concepts, and we will see that we will have an answer, whether it is the kidney 16 area, very common in menopausal women, yes. A lot of time it is the stomach 30, very common in menopausal women. But again, I'm not making a decision. I'm palpating, I'm making a mental note, and then I start treating. And I start treating depending on what I find, and I will give you some ideas. And when I go through my treatments, I always come back and I check, how am I doing in terms of the GYN reflection sites, okay? And I will make it come alive to you as we continue. In the back, naturally, everything that has a front has a back, yes. I'm very, very interested in the region of Ming Men and the bladder 23 for obvious reasons. We're talking about the kidney and the development of Jing. We're talking about the aging process. We're talking about the fertility process. We're talking about something which holds the basis of the yin and the basis of the yang in the body. This can be treatment and this can be reflection. Okay, so not always is it painful per se, but a lot of time I will use that, you will see, also as a treatment to reduce other reflection sites. However, for me, and that is what I see a lot in practice, the extra point Josen, and I will have a video and some explanation. The extra point Josen in the back is one of the major, if you want, balancing reflections of the entire pelvis. Think of the seesaw, yes, where we have two sides of the seesaw, if you want, two vectors. And sometimes it goes, the left goes down, the right goes up, sometimes the right goes down. Yes, a seesaw. The middle point of the seesaw is the fulcrum. So Josen is the middle point. Yes, the Josen is the fulcrum point of the pelvis. So any shift of the pelvis, tilting forward, backwards, shift of the pelvis, side to side, we will find pressure pain on Josen. And it is extremely common, even if we have a fibroid, even if we have a certain pain, you know, chronic cystitis, certain pain, if we have adhesions and pullings like endometriosis, there will be a natural, yes, anatomical, you know, shift of the pelvis, which can be then detected and evaluated if you want.